disability do not discriminate, but the private insurance industry does. There are 74 million Americans like me that are walking around just one sickness away from being medically and financially ruined.
My name is Rhonda Robinson. I'm from Durham, North Carolina. I am a full-time student, a single mom of 2, and I have epilepsy, a pre-existing condition.
My name is Zwan. I am Adam and Jenna's mother and Eddie's wife. My husband was met with stage 4 kidney cancer at the age of 45. Our young, healthy son at the age of 7, we were told, has a terminal disease called Wolfram syndrome. It's a neurodegenerative disease that causes neuropathy of all the tissues, progressing to the brain stem, causing premature death in the 20s and 30s. And therefore he has diabetes, optical atrophy, deafness, and kidney disease.
I was a secretary at Department of Human Health and Services.
I worked in the pharmaceutical industry for 18 years.
I had an on-the-job injury that caused me to get physical therapy.
My family's high medical liabilities drive up the medical liabilities for businesses, and so I lost my job of 18 years.
My employer released me, so I hadn't had insurance for over a year now.
By losing my job, I lost my private insurance.
So I tried to apply for Medicaid, and they said I didn't qualify for Medicaid.
When you lose your job and your ability to provide for your family, a lot goes with it.
And so I said, okay. So I sat there in the chair and I'm like, well, what am I supposed to do for like my medication? Because my tremors started coming back.
I had 2 terminally ill loved ones. We know the reality of disease. We knew our financial situation. And we were in fear of what the future held. Because you're powerless in this whole thing. That's the thing that happens to you.
So I just went and lived on without my medication and tried to get enough rest as much as possible and just prayed.
I have the knowledge of what it feels like as a mother to be dropped to my knees watching my young son fight to live. And the fight shouldn't be to get the care, the fight should be to defeat disease.
I told my son, I said, don't call the paramedics. I knew I was having a seizure, but I knew what the cost would be. When I couldn't control myself and my son and my brother was afraid, that's when they called the paramedics because I was all over the place with my seizures. I have to make a decision whether to buy food or get my medication. This is my Neurontin. This usually costs me over $500 a month, and this medication usually costs me over $275 a month. This is a monthly rent for someone out of pocket. Without the medication, I was sitting duck to die, really. So, yeah.
I never knew we'd be faced with these things either. My son never knew he would be faced with these things. But we have taken the challenges, determined to rise above it.
I'm not asking for a handout or, a free pass, but make it affordable for me to get health insurance.
Every human being should have access to the care that they need to live.
I stand up here before you today as a mother. Don't you want to know that you or your children or your grandchildren are guaranteed the care that they need to live?
Yes.
Then you have got to show up and tell Congressman McIntyre and Senator Hagan that we need them to vote on the people's side.
We have a right to health and prosperity, and that's all I want. I want to live, but we need insurance to live.